Stem cell therapy was once thought to be the storyline of science fiction fantasy, but now some doctors are claiming it's curing, not just relieving, disease and degeneration. Others are not so sure.
I have people saying, well, this is hocus pocus, and that's the naive person. I have so many skeptics coming to me saying, hey, there's no research behind it. There is research behind it. I mean, there's a Mayo study from 2 years ago that has an 80% success rate for bone marrow-derived stem cells for knee arthritis.
So when patients come to me and ask about stem cell therapy, I tell all of them it's still considered investigational and experimental. However, there are multiple trials that have shown good results with stem cell therapy, in addition to anecdotal cases.
The answer is, so far, nobody has shown that scientifically. It's not valid. And practitioners of commercial treatments that have not done valid science, valid, safe clinical trials, valid, safe, FDA-overseen developments are frauds.
Stem cell therapy is not an approved therapy, meaning it is not FDA approved in the United States, nor in other countries. On the other hand, we have enough scientific data as well as enough clinical, partly anecdotal, evidence showing improvements. Improvements with regard to functional capacity of the patients, meaning patients feel better after stem cell therapy, as well as improvements in other regions of the body.
So for me to not offer it to my patients, I think would be an injustice. My goal is to serve my patients to the best of my ability, whether that means traditional or non-traditional methods. This might be considered a non-traditional method, but we've seen success in research and in patient anecdotal cases. And so for me to withhold it from my patients, I think would be a disservice.
To do a therapy, which anybody would say was an experiment, not a therapy.
Okay.
And they're claiming that it is so good that they can charge you for that therapy. That's inappropriate. That's not in line with the oath we all take as doctors to do no harm.
If I have the power to offer my patients a therapy that I think can help, even though it's considered investigational or experimental, then I will offer that to my patient, especially when you're avoiding more aggressive treatments such as surgeries that have far more risks that come with them. And so when I take an oath to do no harm, I give the patients all the treatment options. And so if a patient wants a certain treatment and wants to be educated on it, my job is to educate them. And if they decide that they would like to go through with the treatment, I would offer it to the patient.
I remember at least 5 patients within the last year who were sent to orthopedic surgeons or podiatrists for amputations of toes, feet, or the whole leg, whom we injected with stem cells. In one particular case, in fact, the perfusion improved so much that the patient who was sitting in a wheelchair for years now walks with a walker, but he can walk.
For now, as stem cell science continues to advance, stem cell therapy continues to be debated. How far and how fast the treatment goes seems to depend on the doctors. In Beverly Hills, I'm Barbara Sharp.